Hi, my name is Mackenzie Mazurek, and I'm going to be presenting on celiac disease. Celiac disease is an autoimmune condition that negatively affects the small intestine, and this is in response to gluten consumption. Gluten is a protein that's found in foods containing wheat, rye, and barley. Celiac disease occurs when the body has an immune response to the consumption of gluten. So this stimulates the attack of the small intestine, and it leads to serious complications if it's left untreated. So some genetic factors that contribute to the development of celiac disease: family history, specific genes, and certain disorders. So celiac disease is largely hereditary. Your risk is going to be 10 times higher if a first-degree relative has celiac disease. If it's a second-degree relative, your risk is going to be higher, but not that high. It's going to be higher than if you didn't have a relative with the disease. While it does run in families, a certain inheritance pattern has yet to be established. So specific genes do also contribute to the development of celiac disease. So around 95% of celiac disease patients have a variant of the HLA-DQA1 gene. This gene plays an important role in inflammation and autoimmunity. So your risk is also going to be increased by certain variants of HLA-DQA1 and HLA-DBQ1 and 2 genes. These belong to the family of human leukocyte antigen genes. So certain disorders are also going to influence the likelihood of developing this disease. Those include Turner's, Down syndrome, and type 1 diabetes. So environmental factors that are going to play a role in development are lifestyle factors, infections, toxin exposure, and bodily changes. So lifestyle factors, obviously gluten is going to be the main trigger for celiac disease. Your body's going to make antibodies in response to gluten consumption. Extreme stress can also trigger the onset of celiac disease. It can't cause it, but if you have the genes, it does make the onset more likely. Infant feeding practices are known to maybe delay onset. So introducing gluten into your infant's diet a little bit later can help slow the onset of this disease. Infections and microbiome, enterovirus and adenovirus infections have been linked with the development of celiac disease, especially in early childhood. Impaired gut microbiome is also known to play a role in the symptoms. So toxin exposure, young adults exposed to pesticides, flame retardants, nonstick cookware, they're at an increased risk of developing the disease. So other factors, pre-existing autoimmune conditions, out of all patients that have an existing autoimmune disease, they're 25% more likely to develop another one. So also a person that has a history of type 1 diabetes, this risk particularly is increased. Pregnancy can also trigger this because your immune system is weaker. So demographics of celiac disease, women are going to make up about 60 to 70% of the patients diagnosed with celiac disease, and this can appear at any time from infancy to senior adulthood. But the average age of diagnosis is going to be about 40 to 60. So ethnicity in the United States, celiac disease is the most common in Caucasians of European ancestry, and it's going to be rare for African Americans. And in the world, incidence rates are the highest in Europe and Australia, and North America falls behind Asia. So anatomy, the small intestine is the part of the body that's affected in celiac disease. It's going to be an integral part of the gastrointestinal tract. It's located in the lower part of the abdominal cavity, and it's inferior to the stomach, and it's going to be surrounded by the large intestine. This part of the body is composed of the duodenum, jejunum, and the ileum. So the anatomy of the small intestine. The small intestine is lined with microvilli, which are small hair-like projections that line the small intestine. The function of these microvilli are going to be to increase the surface area of the large intestine. So when the surface area is increased, the amount of nutrients that can be absorbed are increased as well. So when someone has celiac disease, these villi typically they're going to stand straight up and they're going to be able to help absorb nutrients. But when someone has this disease, they flatten. So, and when they flatten, they cannot absorb nutrients as well. So this leads to all kinds of deficiencies and issues. So some of the symptoms associated with this disease are going to be chronic diarrhea, constipation, gas, bloating, abdominal distension, stomach pain. a lot of other body systems are going to be affected as well. So celiac disease is a very diverse presentation. So weight loss, this is due to improper nutrient absorption, iron deficiency, anemia, cognitive symptoms, depression, anxiety, neurological symptoms, cerebellar ataxia, so loss of coordination, headache, epilepsy, nerve pain, neuropathy, low blood counts, reproductive issues, so miscarriages, infertility, skeletal issues, so osteoporosis and osteopenia, dental issues such as increased cavities, reduced salivary flow, so dry mouth, and then integumentary issues, so skin rash, hives, and dermatitis. I actually have celiac disease, and I was diagnosed after having a skin rash and a stomach ache. So physiology, flattening of the microvilli, this is called villus atrophy. This leads to impaired digestion and inadequate nutrient absorption. And this is irrespective of how much food is consumed. So regardless of how much you're eating, you're not going to absorb the nutrients. And this also occurs with medications. And this is because many medications are absorbed in the small intestine. So this can really be a problem for people if they have, life-saving medications they need to take and they can't absorb them. So celiac disease is graded on a scale from 1 to 3 based on severity and villus atrophy, and this is using a scale called the Marsh score. So stage 3 is going to be the most important, and this is categorized by larger depressions and an increased amount of lymphocytes. More importantly, you're going to see flattened intestinal villi and visible villus atrophy. So most practitioners are not going to diagnose celiac disease until they see stage 3. So some long-term consequences, if this is left untreated, it can have devastating consequences. And that includes malnutrition, osteoporosis, miscarriage, infertility, other autoimmune diseases, epilepsy, migraines, and nerve damage. The life expectancy is going to be the same as if you didn't have it, as long as the celiac disease is treated. Diagnosis, this is going to be diagnosed in a couple steps. The first step is going to be a blood test. So blood serology can check for antibodies in the blood. Genetic testing can be performed to check for HLA variants, so DQ2 and DQ8. Endoscopy and biopsy. And endoscopy is going to be performed. So this is going to be a large tube that enters the oral cavity, travels down the esophagus, and enters the small intestine. It's going to take some pictures, and then the area in the small intestine can also be biopsied to check for villus atrophy. And then this biopsy will be reviewed by a pathologist who will grade the sample according to the Marsh score. So the primary treatment for celiac disease is going to be a lifelong gluten-free diet, very strict. This also includes cross-contamination. So eating in a restaurant where gluten is being used to prepare food is not permitted. So be very strict and avoiding cross-contamination, all gluten consumption forever. Monitoring is going to be an important step too. So screening for vitamin deficiencies, years later, bone density screenings. And in some cases, refractory celiac disease can occur. This occurs when you have a continuation of symptoms after adhering to the gluten-free diet for 6 months to a year. Artificial intelligence is currently not used as a first line of treatment or disease detection in celiac disease, but it does have great potential. And that's it. Thank you so much.